To this story now, there are fears that schools may be affected by the cholera outbreak, particularly in Hammanskraal. At least 23 people have died from the disease in that area alone. Gauteng Basic Education spokesperson Steve Mabona joins us to tell us whether schools in the area have been affected and what the department is doing to ensure pupils are kept safe. Mr. Mabona, thank you very much and welcome to All Angles. Clear, the first question. Are you concerned at all, particularly for schools in Hammanskraal and in the Pretoria area, when it comes to this outbreak? In the last 2 weeks, we saw a rapid rise in cases and deaths.
Yes, thanks very much, Maseko and all our viewers. We've been concerned since this cholera outbreak, occurred in Hammanskraal. To a certain extent, that we then devised a plan to say, let's augment in terms of us appointing more service providers to provide water in identified schools, but also make sure that our team visit schools and conduct what we call as advocacy program, working with the Department of Health officials, just spreading the message on how to prevent any contact or anything that will then be a danger, because our learners come from a community, so we cannot segregate them from that process. So hence we felt that let's support them and make sure that we don't experience anything.
Now, you say that you've made sure that you've gotten more service providers to provide water, clean water. But now the issue is, the tests that have been conducted so far don't show any bacteria that leads to a cholera conclusion in water. So it could be anywhere.
Yes, indeed. That's why we are not operating outside the health sector. Department of Health is our sister department. We're in the same cluster, in the social cluster. So any information they avail, at our disposal, so that we then can make informed decisions on how we're going to be assisting. So to a certain extent, that there's officials, from head office that are meeting on an everyday basis with the officials, Department of Health, to make sure that we are aware of what is happening there, to a certain extent that if there's a child that is admitted, we are also informed to say this is a number of children that we have admitted. If they are discharged, then they are also informing us. So we're working with the Department of Health to make sure that we are part of community. Any intervention, we will then have to roll out that in a school environment, because those children come from the same community.
And any communication or confirmation from the health department with regards to the people who are either still being treated or the 23 who have passed on in Hammanskraal? We know that some of them are young people. Any confirmation from the health department that it's any of your pupils in that area, or any teacher, perhaps, Mr. Mabona, who is being treated or who passed away?
No, up to so far, we had 3 cases which were confirmed to us. 2 of those children were then discharged. And the first one is the one that the 3-year-old who will be belonging to the ECD sector. That's the only one that we know about. But for now, we don't have any confirmation of a child or a learner that is in a healthcare facility. But as soon as we have that, we are the first people to can confirm that up to so far, this is what is happening in our sector. We don't want people to lead us in what is happening in the sector, because there's nothing to hide. It's more educative. We need to educate more so that people, take care of their surrounding and what they are doing in and around, most especially our school communities.
All right, let me give you the opportunity then for a message. You say you want to educate. Maybe the fact that the stakeholders in the education department does not only end with teachers and principals, parents as well when children are at home.
Now we will call upon parents to make sure that they interact with the professionals in the event of the symptoms that we are all aware of, diarrhea, fever, anything. We don't need to underestimate those, more so in those areas. So sometimes, if you don't feel well, we are prone to self-medicate, as we grow up, probably most of us are fond of that. But when you're in that area, I think it's advisable to interact with the local medical facility so that they can guide you on the way forward, on what is it that you need to do. And I think that's what we really need to do. Let's act, let's not wait, because the process of assisting is there. So let's utilize that process and make sure that we take heed to all these messages that are coming our way as a community.
Steve Mabona, the spokesperson of the Gauteng Education Department, thank you very much for your time.